Oops. Okay, we are good. So whenever you're ready.
Okay. The U.S. needs to adopt a single-payer healthcare system, much like the U.K., Canada, Germany, Sweden, Switzerland, and many other countries in order to adequately care for its population, to bring the extreme cost of healthcare down instead of the continuing implementation of the Affordable Health Care Act. From here on out, I will refer to the Affordable Health Care Act as the ACA. This healthcare crisis needs to be addressed by providing public-funded healthcare to all citizens by lowering the administrative cost of healthcare in the United States. By providing this will provide further autonomy to doctors, provide free state-sponsored healthcare to all, and eliminate out-of-pocket expenses. The current harms, at best 29.8 million will be left uninsured after the full implementation of the Affordable Health Care Act by 2016, according to Narden, who is Chief of Neurology at Cambridge Health Alliance. She states that the Supreme Court decision to allow states to opt out of the Medicaid expansion weakens the ACA's impact because the ACA also reduces funding to safety net hospitals. States' refusals to expand Medicaid will likely result in both medical and financial hardships for vulnerable Americans. We found that if all currently undecided states opt out, 29.8 million people will remain uninsured, whereas if all opt out, the number of uninsured will total 31 million. That's Wisconsin, the population of Wisconsin, Iowa, Dakota, and Minnesota. Double that is the amount of people that would not have health insurance. Even though we are the richest country, we are by far not the healthiest. According to PhD Davis, who has a focus in health policy management, although American life expectancy and health have improved over the past century, these gains have lagged behind those in other high-income countries. These health disadvantages prevails even through the United States spends far more per person on health care than any other nation. Administrative costs are higher in the U.S. than anywhere else. According to Hamilton, MD, who has over 100 authored or co-authored publications, administrative costs accounted for 25.3% of the U.S. hospital expenditures, a percentage that is increasing. Next highest were the Netherlands at 19.8% and England at 15.5%, both of which are transitioning to a market-oriented payment system. Scotland and Canada's single-payer system pays hospital global operating budgets and lowest administrative costs, producing U.S. per capita spending for hospital administration. People will go without health care due to the cost. According to PhD Davis, given the absence of universal coverage, people in the U.S. go without needed health care because of the cost more often than people do in other countries. Americans were the most likely to say that they had access problems related to the cost. Patients in the U.S. have rapid access to socialized healthcare services. However, they are less likely to report rapid access to primary care than people in leading countries. The impact, according to the Congressional Budget Office, insurance coverage provision of the ACA in March 2015, 27 million Americans will remain uninsured in 2025. Tens of millions more are uninsured, and physician's choice is restricted except in traditional Medicare. The inherencies to this issue is the current government actions of the ACA have major shortcomings. According to Jonathan Cohn, a well-known journalist and author focused in healthcare, tens of millions of people will remain uninsured even after the law has fully phased in. Many will lack health insurance, putting them at a risk of financial catastrophe and adding to the strain of safety net. Even those who have insurance will find their coverage leaves them exposed to high out-of-pocket costs, lower than before, perhaps, but still high enough to cause hardships. The ACA will not fix the issue of out-of-pocket expenses. According to Gruber, professor of economics at the Massachusetts Institute, about 10% of families will not have enough money for premium and out-of-pocket expenses if they got severely ill, It is safe to say that since it is a major healthcare reform in the past 30 years, that the ACA is here to stay. The United States Congress should implement a single-payer system in order to provide attainable health care to all of its citizens. This will be funded through the general federal revenues and be enforced by the U.S. State Department of Health and Human Services. Right? And the solvency for this is that the problem can be fixed if the government is the sole payer. According to Himmelston, MD, the single-payer program could be funded by saving obtained from replacing today's inefficient profit-oriented multiple insurance payers with a single streamlined non-profit public payer, and by modest new taxes based on the ability to pay. Premiums would disappear, 95% of households would save money, patients would no longer face financial barriers to care such as co-pays, deductibles, and would regain free choice of doctor, and hospital doctors would gain autonomy over patient care. That is it.
Okay, cross-examination.
You want me to start?
I got it.
Oh,
Stand up. So, when you do cross-ex, you have to stand up.
Oh, I do. Okay, I'm sorry. Okay, so stay there for a second.
No, you don't flow the cross-examination. Yeah.
Okay, just in terms of your inherency, the article you mentioned something with hardship. Does it give any type of definition of what constitutes hardship?
Let's see, the hardship, and the inherency, tens of millions of people. Was this the Jonathan Cohen?
I believe so.
Essentially, what he's referring to is the bottom economic, or really not the bottom, it's in between what Americans would classify as middle class and the bottom. So the bottom are taken care of by Medicaid or Medicare, depending on your age. So it's really kind of the people that fall in between the lines. Well, that'll be kind of the, like, at best, the 29 million that'll be uninsured.
Okay. Just quickly, could you reiterate what countries you mentioned also do a single-payer health plan?
Well, the United Kingdom,
Yeah.
Canada,
Okay.
Germany,
Okay.
Sweden, Switzerland, and also Taiwan.
Awesome. That's all I got for cross-examination. Can I take my a portion of my 4 minutes to instruct something?
Sure, I will call it out every 30 seconds.
Awesome, thank you.
Seconds used. You're allowed to have a chair, Collin.
Okay.
1 minute used. How's the flowing going? Pretty good?
I'm a bit confused on what's
Oh, well, you don't do that till the end. So,
Do we just use one of these all the time?
yeah. No, on case and off case,
Oh, so you distinguish that the negative will be this one right here?
if they do off case. So if they do disadvantages or counterpoints. If they directly refute the case, that goes on case.
Oh, yeah, I got it. It's organized.
I'm
Ready? Okay, you have 1:34 remaining,
For
prep time.
prep time?
Yep. Okay,
Okay.
all right.
Awesome. Well, just for some signposting, I'm going to start with listing a disadvantage to a single-payer health care plan. Next, I'm going to go on to how it, as mentioned previously, the current healthcare system is inefficient, and it has not been mentioned how a single-payer healthcare plan would fix those inefficiencies at all. Thirdly, there has also been a mention to how a single-payer healthcare plan has been used in Canada and other Western European countries. However, I'm going to contest the fact that due to the scale and the size of the United States, the scale of the United States will make it almost unachievable to reach that. And also the fact that, as Collin mentioned, there would, in one of his articles cited, there's a potential for an increase in taxes, which can also be discussed. For the disadvantage, a single-payer healthcare system involves politicians who are focused on elections, then healthcare. As a result, they fail to properly administer healthcare, which means that single-payer healthcare would not be properly working. For example, one example of a contemporary thing where currently politicians in Congress are in charge of operating Medicare, which in terms of Medicare, as stated by Ezekiel Emanuel, a professor, a published author, the cost control in a single-payer system is that adopted by Medicare in the United States. Do nothing and just wait until whatever bill comes in. Let the costs go through the roof. The crisis will come later after the current administrators and politicians are gone. In other words, the politicians are more focused on pleasing people now rather than actually taking care of and solving a problem which could also contribute to the debt crisis which we are currently facing. Additionally, politicians are also motivated by interest groups rather than what is actually seen as fair and helpful to society overall, which again comes from Professor Ezekiel Emanuel, where Medicare reveals what is likely to happen if we have a single-payer plan. Every Medicare decision is subject to political pressure from somewhere. When Medicare tries to lower hospital fees or equalize payment, hospital pressures their representatives and senators for increases in payments. Patient advocacy groups lobby to have Medicare pay for their favorite technology or treatment. Drug companies use campaign contributions and patient advocacy groups to prevent a Medicare formulary and forbid price negotiations, as might limit their profits. The result is that Medicare decisions are made slowly and rarely on their merits. No federal administrative agency has been completely free of political influence. Additionally, politicians are also rather stingy with their money, which could come to affect people's overall care because the government may not be willing to spend the money to get and utilize the proper technologies that would help take care of people. For example, from Professor U. Reinhardt, who was a professor at Princeton, in a single-payer system, spending on healthcare is pitted against other government priorities and easily falls victim to the politicians' perennial desire to campaign on tax cuts, which additionally, as Collin stated, there's a chance that there might actually be an increase in taxes, which is not good. The bare bones technology, physical amenities, and cues that unduly low global budgets and a single-payer system tend to begin inevitably to trigger political forces for turning the system over to allegedly more efficient private market forces. Additionally, in government programs, there has also been a higher rate of fraud, which fraud also takes away from the whole save money efficiency portion of the idea behind a single-payer system, where, according to, again, Professor Ezekiel Emanuel, low administrative cost wanted by politicians causes fraud and loss of funds. At the time, the IG estimate that Medicare made about $2.3 billion in improper payments due to insufficient or absent documentation, incorrect billing for excluded services, and other problems. In 1966, Medicare spent about $200 billion, thus fraud was over 10% of total Medicare costs. I leave you to imagine why the government has not repeated this assessment in the last decade. In other words, Medicare is fairly similar to what a single-payer healthcare plan would be, where the government is in charge of the funding and the payment. And as seen in Medicare, there's a big, due to the government trying to have low amounts of administrative costs, they allow fraud, which in the end causes an even greater loss. So, and in terms of other countries, it was mentioned that the U.S. could do this because other countries such as Canada, the UK, Germany, and the Swiss also use these types of innovative plans. I would just like to state, based on the CIA World Factbook, that the population of Canada is 35,099,863, where the population of the U.S. is over 300 million. So the U.S. is by far larger than Canada, and Canada is one of the larger countries that utilizes this system, which can also be attributed to the
Okay, cross-examination. Everybody's got to stay standing up.
oh, sorry.
It's okay.
Okay, so first of all, I'd like to touch on the, you said the government's higher rate of fraud.
Yes.
What about the fraud in private sectors, such as Enron, who devastated millions of people through lying about oil and such, or Bernie Madoff, characters like that in the private industry that took billions and billions away from private people. So it's safe to say, or what's your take on that?
Well, for one, that wouldn't be healthcare, and those are more, for example, the Bernie, I can't pronounce his name if I'm dependent on it, but that's a single person, where this is a purely administrative failure by the government, which is why I would say it's different than just corporations and singular individuals lying to people.
Okay, and on interest groups, what interest groups exactly were in there? Were they like human rights interest groups? Or were they
Give me a second to
insurance interest groups that didn't want their payments taken away? And it was the Ezekiel
Right.
article.
Yep, the article does not specifically say which insurance groups, although it does mention patient advocacy groups and drug companies as well. If you want to take a look at
It says
this,
drug
this,
companies?
yeah, it's
Okay.
the middle one right there. If you want to take a look and see for yourself. Do I have to verbally say what's on the paper for the camera or not?
No.
That's fine. Just fine.
Okay. And you said that politicians may be looking for the vote and not really doing what's good for the people,
Yep.
correct? But then you brought up the deficit and how this might further the deficit and how taxes are bad. However, do you think that taxes could possibly be good and politicians need to push for the taxes because that's really what's good for the people instead of getting them elected?
I would have to say it comes down to who do you tax. For example, you haven't specifically said who you would tax, so for the sake of this debate, you could be taxing the lowest 10%, which could cause them even more hardship than they could be saved by a single-payer healthcare system. So,
And also, did any of your articles look at the, alright,
All right. Collin, do you want to take some prep time or? do you
yeah, I'll
want-
go with some prep time.
Okay. How are we doing now with flowing?
We're supposed to be on the third
Same one still, right?
Yep.
Perfect. Yeah.
Yeah, we're going into the third one.
Okay. So when I think about the counter plan, they were on the spreadsheet.
But he had a disadvantage